Hi there, hello. Welcome back to my YouTube channel. I am Dr. Fatma Salim. I'm here to educate patients as well, brainstorm with fellow medics on how to give quality healthcare services. Please subscribe if you have not done so. If you've done so, thank you so much. Well, today I would like to discuss a disease that is actually very vital but has been neglected for a while. Ooh, I'm sure you are wondering why I'm using the term neglected. Yes, a lot of you are not aware of it, and it is literally very dangerous in the sense that it has once it's complicated and there is no going back. It's really fatal, very fatal. Well, the disease that I'm talking about is hepatitis B. Yeah, I know you're wondering, or you're probably thinking, no, that's not a disease that is very dangerous. A disease that is very dangerous is HIV. Yeah, it's cancer. Yeah, Ebola. Yeah, I'm sure, because you don't know the depth about this disease. You like, yeah, once I explain to you, then you will understand better. So I'm here to let you know about this disease. Well, hepatitis B is infected by hepatitis B virus, and this virus can like you can get it through a blood transfusion, you can get it through sexual intercourse, you can get it through child to mother, during birth, when a mother who is infected, gives birth to a child, then that child can literally be born with hepatitis B and all that, the different ways of how hepatitis B can be transmitted. Well, clinical presentation is literally, it comes very late. The disease can be there for over 10 to 20 years without someone realizing that they're having the disease. And like here, we don't test for it, not randomly, unless maybe you're working for an NGO or you have a need to have clearance or screening. That's when one gets to be tested. But just like that, just randomly, it's not tested. Or maybe if you have some clinical symptoms with clinical presentation, then at least that would be suggestive. So to say, yeah, the disease get noticed, or someone realizes, or someone is diagnosed with the disease when it's actually towards the end stage, when it is very severe. Well, yeah, how is this disease dangerous? This disease is dangerous because the longer the virus is in your liver, actually it attacks the liver. It eats on those liver cells and all that. So the more it stays there, the more it's damaging your liver. So before you know it, your liver has been eaten up, in which we call it, uh, your liver would have been damaged, in the sense that you get to have these symptoms of bloatness, of vomiting. Some people get to lose their appetite. Some people get to vomit blood. Some people get to have some skin marks. Some people get to have accumulated fluid in their abdomen and all that. Once your liver is affected, then your liver, once it is affected, then it would have compromised other organs. For instance, the gallbladder, the pancreas, the kidneys. All these organs are interconnected. So when once the liver is affected, then you can imagine what would happen to your body. So this disease is dangerous because of that. Yeah, and it also leads to cancer. When the disease is actually, when the virus is in our body has a way of actually fighting it. Yeah, has a way of producing these antibodies. These antibodies are, so to say, the soldiers that help the body to fight the disease. So these soldiers go to attack the antigens. Oh yeah, antigens is the virus soldiers. So our soldiers in our body gets to fight with these soldiers in the virus. And as they are fighting and all that, they can get to a point whereby the virus can be eliminated from our body, be defeated, so to say. from our body. But the worst is that, you know, when there is war, when people are fighting, there would be like collateral damage, you know, someone would have died, you know, someone would have been injured and all that. So the same thing happens to our liver. Our livers get to scar, you know, like the tissue gets to become abnormal, and once it is abnormal, it cannot function properly and all that, and then you get to have this complication and all that, depending on the depending on the severity of this, you know, abnormal tissues and all that. And eventually someone gets to have cancer of the liver, known as hepatocellular carcinoma, you know. So someone gets to have that, and then you get to be like, you know, to be fighting cancer. You have to be treated for cancer and all that. So it is that much bad. The worst is that, you know, this disease cannot be caught in advance, because we don't test people randomly. Like patients don't come like voluntarily, I want to be tested for hepatitis B and all that, until when they start developing these symptoms, you know. Yeah, so because of that, you know, the disease gets to stay in our body for longer, and as it does that, it damages the body and all that. So but this could start, you know, from teenagehood and all that, because of unprotected sex and all that. It starts from earlier in advance, you know, earlier. So if for instance, if people would volunteer to go and be checked, once someone finds that they are positive, then there are some implementation, some process to help the patients, you know, fight this disease. But in case someone has not, someone is negative and all that, then they can be vaccinated. So testing for this disease earlier in advance is actually very vital, in the sense that, you know, if one is found not to have this disease, then the best is to be vaccinated. You can be vaccinated with hepatitis B. So this video is to bring awareness about this disease, and to encourage you to go to the nearby center, get tested. If you turn to be negative, kindly consider getting vaccination, because you getting vaccination is safe for you, is safer for you than you getting the disease, you know. And the fact that we've not been tested, we could be living with someone who has the infection at home and could easily pass it through us, because like I said, remember, when it can be passed through blood, it can be passed through sexual intercourse, it can be passed from mother to child and all that, you know. So you can imagine, these are the people that we live with at home and all that. We don't know who is who, because we've not been tested, right? So we someone gets a cut, or someone yes, had some accident, and we rush to help. Unfortunately, we have an open wound, or a cut or something, you know, and then their blood touches on ours, you know, or because of sexual intercourse, when because of, you know, someone is pregnant, has not been tested for the the virus and all that, for the disease, and then they get tested, they're positive, and nothing much can be done, because the mother's blood, you know, circulates in the placenta and all that. So a baby can easily catch this disease through those. It is better for you to get tested, so that you can protect your loved ones, so that you can get management earlier, because this disease, unlike HIV, this disease can be cured. People get cured as long as you get the right treatment at the right time. So you rushing to the hospital to be tested earlier in advance, you can actually receive early management, and eventually, you know, this disease subsides without causing any much damage to your liver, you know. Yeah, at the same time, you get to protect your loved ones, you get to protect your others, you know. If you, for instance, have the disease, then you protect others, in the sense that you will be very cautious with what you do. Thank you so much for listening. Please, if you have any queries, or if you are suffering from this disease and you are in Kenya, you are in Mombasa, I would like to hear from you. Or if you are in Kenya and you have some queries and all that you'd like me to attend to, kindly comment below, or reach out to me. yeah, I will very much appreciate to assist you, and yeah, in whichever way possible, you know. Thank you so much for listening. If you have not subscribed, please do so. Yeah, and share with your colleagues, share with your friends, share with your neighbors. Just ensure that this word goes around. Everybody gets to be informed about this. Create awareness. It's very vital, because unfortunately this disease is a silent killer. It only erupts when things are very serious. That's when you get to have these symptoms, you know. So kindly spread the word, ensure that people are aware, get tested. It's very important. Get tested. If you're negative, get vaccinated, and if you're positive, reach out to me. Let's see how we can help you. Thank you so much. Nice time.